Absolute salam, everyone. It's an honor for me to introduce this session and the speakers. About a year ago, we had a team of Mumineen, pediatricians, educational specialists, therapists, and other child health specialists in America who got together with an initiative to prepare a parenting curriculum that supports parents to provide their children with dini and dunya ta'aleem, with the ultimate niyat that they and their children attain Mola Tollam Sharif's Khushi by following Siratul Mustaqim. This can sometimes, as we know, be especially difficult in the culture of the United States. हमारा बारवा शफीक अली कदर मुफद्दल सैफुद्दीन तौल्लम शरीफ वारंबार फरमावे छे कि हमें एना प्यारा फर्जंदो छे मुफद्दल मौला सिखावे छे बच्चाओनु तरबियत केम करवू जोईए ए ज मिसल सैयदना मुफद्दल सैफुद्दीन बारहा फरमावता होय छे कि स्ट्रेस एंग्जाइटी अने बीजा मेंटल हेल्थ इश्यूज जे आजे घना एम छे एनाथी बचाव वास्ते एक आला रस्तो शू छे कि इमाम हुसैन अलैहिस्सलाम पर नोहो अवील करीने हमेशा आपनी जिक्र करवू ये हमारू थेरेपी छे. Before we introduce the esteemed panel of speakers, I just want to recognize the team that's worked over the past year in preparing this parenting curriculum. Just to run through the names, Dr. Alefiyah Bharmal, Dr. Sheikh Wazema Palanpurwala, Dr. Lulua bin Mandviwala, Dr. Alefiyah bin Malbari, Dr. Mustafa Abdul Hussain, Tasneem bin Kagazwala, Zainab bin Ship Chandler, and Rashida bin Haveliwala, and Sara bin Tawawala. So Dr. Lulua will come up and introduce the speakers. Just to kind of touch on how this presentation will go, in the first half you'll have the CME talk with Dr. Alefiyah, and then you'll have our other Dr. Alefiyah who will present some of the data that we've collected and prepared over this past Shirullah. Then we'll break for lunch. After lunch, Rashida bin will come up and kind of walk us through the preparation for this parenting curriculum that is in the process of being developed. And we will look to everyone here for support. So we're in the early processes of preparing a parenting curriculum that will work in conjunction with madrasa and ta'aleem. And we need we're looking for anyone who's interested in being a part of that curriculum presentation. So we'll have an opportunity for people to ask questions, but also to register their names and contact as we build a team to start to develop this curriculum.
Assalamu alaikum. Thank you, Dr. Mufaddal Bhai. So this is actually Dr. Mufaddal Bhai's brainchild, I would say. He came up with this idea and corralled some of us, and it's just blown up. Want a special thank you to Amir Bhai Saab and Mukasir Saab for his support as well. So to introduce our esteemed panel here, Dr. Alefiyah bin Bharmal has her doctorate in clinical psychology with a specialization in pediatric neuropsychology. Her expertise is in the psychological and neuropsychological assessment and treatment of individuals across the lifespan, beginning at age 3 years old through geriatrics. She is the director and owner of Healthy Minds Psychological Services, a private practice here in Dallas. She loves to teach and is a clinical supervisor for doctoral students, fellows, and therapists. Also, she is a mother of 3 children and can speak to the nuances of raising kids in different generations. Welcome, Dr. Bharmal. I'm going to introduce the other 2 speakers as well. We have Dr. Alefiyah Malbari and the speaker in the afternoon session, Dr. Rashida Haveliwala. She's a doctoral candidate. So Dr. Alefiyah bin Malbari is Chief of the Division of Ambulatory Pediatrics and Associate Professor in the Department of Pediatrics and Department of Medical Education at the University of Texas at Austin Dell Medical School. She practices outpatient general pediatrics and has a strong clinical practice building expertise along with a passion for medical education, curriculum development, dissemination, and assessment. Welcome. Rashida Haveliwala is a passionate advocate for quality education with 17 plus years in the American education system. She holds a BA in history from San Francisco State University, a Master's in Arts in Curriculum and Instruction from the University of the Pacific, and is pursuing a doctorate in education, kindergarten through 12 professional leadership at the University of Houston. Rashida Bin's roles have included history teacher, model UN advisor, Title I specialist, and school director, emphasizing multimedia project-based teaching. She also served as National Education Committee co-chair for the United Nations Association, receiving the 2017 Global Impact Leadership Award for her community leadership. We'll see you in the afternoon. Okay, Alefiyah bin Bharmal, if you can go ahead. Dr. Bharmal.
Shukran for the introduction, Dr. Lulua bin. Taslimat sagla sahibo, apni raza se main shuru karu chu. I want to first thank SBMAA for having me here today. I am a clinical psychologist and I work with individuals of all ages, but pediatrics are my passion. Putting this presentation together for you all really got me to reevaluate why I do what I do. And we all have these moments where we have a reflection about why did we choose this path. There's 1,000 paths that we could have taken. Why did I choose this one? So this was one of those moments for me. Before I start, I'd like to invite you all to use your empathy ears while you're listening to this presentation. Let's try to put ourselves in the shoes of our children. I don't have any disclaimers here. So today we're going to be talking about the pediatric mental health crisis and correlates of parenting. So we'll be talking about what pediatric mental health is, analyze some data, we'll discuss some risk and protective factors, talk about how parenting styles correlate with mental health outcome, and I will offer some parenting strategies for teens. Being mentally healthy during childhood means reaching developmental and emotional milestones and learning healthy social skills so kids can cope with problems as they arise. Mental disorders among children are described as serious changes in the way children typically learn, behave, or handle their emotions, which causes distress and problems getting through their everyday life at home, at school, and in their play activities. Mental health is not simply the absence of a mental health disorder. Children who do not have a mental disorder might differ in how well they are doing. And children who have the same diagnosed mental disorder might differ in their strengths and weaknesses, their overall development, and how they're able to cope with life. Mental health is viewed as being on a continuum, and the identification of any mental health disorder is simply for us to understand how well that child is doing. So let's look at this case study of Moise Dikra. From age 5 years old, Moise Dikra was physically abused by his father and witnessed to parental discord on a daily basis. He acted out aggressively at school. His teacher simply saw him as a troublemaker and continually punished his behavior. He had some difficulty learning, which caused him difficulty turning in his homework and in turn resulted in lower grades. His parents pulled him out of basketball, which was his only real outlet. At 13 years old, Moise drops out of madrasa because he finds it to be an unwelcoming and harsh environment. He didn't speak Lisanu Dawat as well as his peers did, and so whenever he would go to madrasa, he would be reprimanded for that. He soon stopped going to masjid events. At 18, he got a job and began hanging out with the wrong crowd because this is who he felt accepted by. Holding down a job was difficult for Moise Dikra because of his aggression. He often clashed with his coworkers and his supervisors. Moise Dikra began to go to parties with strangers he met online and began to use alcohol and substances like cannabis. He was later pulled over for reckless driving. By the time Moise Dikra came to me, he was in his 30s, he was actively suicidal, and his mental health issues were so entrenched that he required significant therapy and medication. With a show of hands, how many of you guys think that Moise Dikra's life may have been different had he have received mental health treatment as a child? I agree with you all. If he was taken to a mental health provider where he could have received an appropriate diagnosis, appropriate treatment for himself and his family, I believe that his life may have been drastically different. So what did I do with Moise Dikra? I worked with him for about a year and a half, 1 to 2 sessions a week, depending on his level of risk. And you may be wondering why I referred to him as Dikra when he was obviously Marad Bhai, right? He was in his 30s when I was working with him. I worked with Moise Dikra's inner child. I worked with his feelings of resentment, his anger, his hate that he had built up from his childhood, from the way that he felt unsafe in his own home and in the community at large, at madrasa and at school. There were many projections and instances of parallel processing that came up where he subconsciously viewed me as his mother, and we were able to heal from that. I gave him a holding space. I never judged his strong emotions and helped him understand where his aggression came from and how to appropriately channel it. We took our time to role play, and we wrote letters to his perceived perpetrators. We worked on identifying his negative maladaptive thinking style, and we worked to reframe his thinking style to make him more grounded in reality and more adaptive for him. We talked about compensatory strategies, like looking for acceptance in harmful places and using alcohol and substances to cover up his emotional pain. I empathized, but at the same time, I helped him formulate his own boundaries by looking at the consequences and actions of his behaviors. And through it all, he was kept accountable, but in a nurturing sort of way. We wrote a new narrative for his future. The guy that refused marriage was slowly able to identify the kind of man, the kind of husband, and the kind of father that he wished to be. He began to love himself and feel that he is lovable. This is a story of success, despite the hand of cards that he was dealt, but it doesn't always end this way. So what did we learn from Moise Dikra? Moise Dikra teaches us that it's not easy for a child with mental health illnesses to make a successful transition into adulthood. We already know from previous studies that most adults with mental health issues had a previous psychiatric disorder in childhood. Most common chronic conditions occur in middle adulthood, with the exception of mental health illnesses. Symptoms for mental health illnesses usually start in childhood and have the biggest disease burden in terms of financial cost, mortality, and other indicators on youth from ages 10 to 24 globally. Research conducted in 2015 by Duke University researchers, there was research conducted that was dubbed the Great Smoky Mountains Study. It was a longitudinal study, and the research followed 4,500 children from 1993 to 2015. The children were ages 9, 11, and 13 at baseline and were assessed every year until they turned 16, and then again at 19, 21, and 25. The findings from this research are alarming. Children with a diagnosable disorder were 6 times more likely to experience at least one of what researchers described as adverse outcomes in adulthood, such as addictions, incarcerations, teenage pregnancy, and high school dropouts. They were also 9 times more likely to experience 2 or more of these outcomes, the following outcomes: health issues, legal issues, financial issues, and social impairments. And these outcomes are indicators of impeding functioning over a long period of time. So this is evidence for childhood mental disorders having implications years down the road. The research also looked at sub-threshold cases. And these were children that had some symptoms of mental health illnesses, but didn't quite meet the actual diagnosis. So these children were 3 times more likely to experience adverse outcomes compared with those who had no symptoms during childhood. And they were also 5 times more likely to experience the long-term outcomes. So what this tells us that psychological problems, they put kids on some sort of trajectory that makes it really difficult for them to get off of, just like Moise Dikra, right? So when we look at 5-year trends in childhood well-being from 2016 to 2020, what do we see here? 20% of 3 to 17-year-olds have a mental health disorder. Just between 2016 and 2019, there has been an increase by 27% in the diagnosis of anxiety and an increase of 24% in the diagnosis of depression. Suicidal behaviors among high school students increased more than 40% overall. Suicidal deaths for individuals aged 12 to 17 increased by 70%. Suicide is the 4th leading cause of death amongst individuals between ages 15 to 29 years old. So presently, we don't have any quantitative data for Mominin Farzando mental health illness, but we do have a lot of qualitative data. And this qualitative data, it comes from the children that we treat, their families, and the stories that we hear. Our bachao are just as vulnerable to mental health illnesses as the general US population. Apna bachao ma bhi घणु थाई छे અને ખાસ જે ગૌર કરવાની ચીજ છે is self-harm and suicide, completed suicide. Ignoring these issues and not handling them appropriately won't change this trend, and it will only continue the stigma and the cycle. We have to take this more seriously, and we have to start planting seeds to make a change. The first change, the place of change, is our own homes and how we discuss mental health with our own children. So despite the increasing mental health needs amongst the children, as the data shows, the studies find no significant improvements in receipt of mental health treatment or counseling in the past 5 years. When looking at disorder-specific data in the US, we could see that the most common diagnosis in 3 to 17-year-olds, ADHD, depression, anxiety, behavioral problems. Having another mental disorder was most common in children with depression. About 74% of children with depression also met criteria for anxiety, and about 47% also met criteria for a behavioral problem. So this kind of tells us that there's significant comorbidity between these disorders. Now, when I see the data collected by the CDC on adolescents, these numbers are just breathtaking to me. I started highlighting some of them and quickly realized that I'll be highlighting all of these. Some of these percentages, they look quite small, right? This, like 8.9, 1.6, they look quite small, but they actually result in millions of our children's lives. Over here, 37% of adolescents had persistent feelings of sadness or hopelessness. If this is not a crisis, I don't know what is. There's so much substance use, there's so many attempted suicides, and there's so many millions that have led to hospitalization. So let's now look at this article to talk about risk and protective factors for mental, emotional, and behavioral disorders across the lifespan. If you guys want to scan this QR code, you can pull up the document that I'm referring to. I found this document really helpful because I'm a visual learner, and it has all these factors on one sheet of paper. You can see the individual, family, and community involvement in mental health issues. You can look at which traits are protective factors and which are risk factors. And you can see what traits lead to what kinds of diagnosis and what diagnoses are most common across the lifespan. What we really can see from this article is that mental health problems are complex, right? Someone who has several risk factors could have more resiliency towards problems than someone else who experienced 1 or 2 risk factors and has a lower resiliency and actually develops a mental health issue. It's important to remember that each individual person experiences stress, pain, and risk in different ways. So what are some of these risk factors in childhood? The science of child development shows that the foundation for sound mental health is built early in life. So what does this mean? These are our relationships that we have with our parents, our relatives, our caregivers, our teachers, our peers. These experiences shape the developing architecture of the brain. At the Center on the Developing Child, a Harvard University program, there has been extensive research on the misconception that genes are set in stone, showing that early childhood experiences can determine how genes are turned on and turned off. Ensuring that children have appropriate growth-promoting experiences is a protective factor from the development of mental health illness. So, while genetic factors exert potent influences, environmental factors have the ability to alter the genes that are inherited. Toxic stress can also damage brain architecture and increase the likelihood that significant mental health issues could occur either now or later in life. Toxic stress can impair school readiness, academic achievement, and have both physical and mental repercussions throughout the lifespan. The emotional well-being of children is directly tied to the functioning of their caregivers and their home environment, their mahol at home. So if these relationships are abusive, if they're threatening, if they're chronically neglectful or otherwise psychologically harmful, then they are a powerful risk factor for the development of early mental health problems. In contrast, when these relationships are reliably responsive, when they're supportive, they can buffer young children from the adverse effects of any stressors that they might be undergoing. What are some factors affecting adolescent mental health? Right, many of the decisions, the actions, the responses that are taken by teens are influenced by the developing brain during these formative years. So a review on neuroscientific research on brain development during adolescence concluded, during adolescence, the brain develops to become more efficient, but heightened neuroplasticity leaves young people more open to external influences. So research shows, for example, that neighborhood features such as the absence of the opportunity for physical health, physical activity, or an abundance of vaping stores in the community leads adolescents to exhibit health risk behaviors, such as leading a sedentary lifestyle and drug use also. Changes to the areas of the brain responsible for social processes can lead teens to focus more on peer relationships and social experiences. So the emphasis on peer relationships, along with the development of the prefrontal cortex, which we all know is responsible for all the higher order learning, proper judgment, problem solving, executive functioning, right? It might lead these teens to engage in more risky behaviors because the social benefits end up outweighing the possible consequences of the decisions that they're making. Other factors that matter, we've talked about sleep a lot today. So sleep deprivation dramatically affects mental health and can act as a predictor for depression amongst teens. Teens need around 9 to 10 hours of sleep per night. How many of y'all's teens actually get that much? Oh, no, right? Mine doesn't. So research shows that if teenagers' sleep drops below around 6 hours consistently, then they are more likely to engage in risky behaviors, in harmful behaviors, in aggressive behaviors. They're more likely to be irritable, more likely to be impulsive, and have difficulty concentrating, just like adults, right? So tech in the digital age, there are growing concerns that digital technologies and social media exacerbate feelings of depression and anxiety amongst teens. They also contribute to higher rates of self-harm and suicide. Undoubtedly, social media has made it easier for children and teenagers to get access to unsuitable content and also fall victim to bullying. Bullies now have access to their victims, all the time. It's so easy for them to spread malicious rumors. So here's a good spot to talk about parental tech use, right? Research suggests that phone usage has an effect on both child and parent behaviors. One study found that parent tech use predicted more child behavior and emotional problems. And another study found that when parents are absorbed in their phones and their children are around, they're more likely to react in a harsh manner towards their children. So this doesn't mean that we need to, abandon our phones, because we all know we can't last a minute, right? But it does mean that we need to be more mindful of how we use our phones around our children. Diet and nutrition, we've been talking about this a lot today too. A healthy, balanced diet correlates with more balanced mental health and fewer instances of anxiety and depression. During adolescence, our teens are going through growth spurts, right? They want to eat all the time, the frequency increases, the amount increases, and they're not necessarily eating the healthiest things, right? Takis are not necessarily the healthiest. While it's vital not to point out everything that they're eating, it's important for us to be healthy role models, right? Show them what healthy eating looks like. Encourage them to make good choices and choose from all the healthy food groups. Social, societal, and environmental factors. A mammoth task for adolescents is to form their own personal identity during this time. So in the literature, teenagers that are coming in with depression, depression, alcohol use, and eating disorders, they report heightened sense of identity-related issues. Increasingly, global issues like climate change, COVID-19, the war in Ukraine, it's all kind of exacerbated the rise in mental health illnesses amongst our teens. Because these kind of issues, they make our teens and children feel less confident about their futures, fueling a higher sense of anxiety and depression. And last but not least, I'm up here today to talk mainly about parenting, right? So let's talk about that. So here are the famous 4 parenting styles that are most commonly discussed. They're categorized based on 2 dimensions of parenting behavior. Demandingness, which refers to how parents control their child's behaviors or demand maturity. And responsiveness, which refers to how much parents are accepting and sensitive to their child's development and emotional needs. So if we could see here, if you're high on the if you're high on the demandingness and high on the responsiveness, you've got it down, right? You're the authoritative parent. You're the best parent out there. You have clear and consistent boundaries, open communication, you're nurturing and affectionate, and you have high expectations for your children. And there are a lot of benefits. These are some of the researched ones in outcomes of children. So the one I want to touch on right now is this better mental health one. So research shows that kids who have been parented using the authoritative style of parenting, they have less depression, less anxiety, less suicide attempts, less delinquency, and less substance use. So that's our goal, right? We want to all try to get there. Where do you guys think Moizdika's father was? Any guesses? I heard authoritarian. I would say authoritarian on steroids, right? He's very physically abusive, very emotionally abusive. What about his mom? We don't know much about his mom. I didn't tell you much about his mom, but if you could take a guess. Uninvolved, I heard someone say that. I agree. She had her own problems. She was, battling this relationship issue she was going through with her husband, domestic violence, a lot of family history of issues too. So she was kind of uninvolved. She kind of took a step back, she had low demand for her child and also low involvement. So if you guys are interested in learning more about parenting styles, we do have a breakout session after lunch, and we're going to be doing some fun interactive stuff in there, so we can talk more about that then. So positive parenting. Positive parenting falls under the great authoritative style of parenting, right? What are some words to describe positive parenting? Parents that are caring, teaching, leading, communicating, providing needs, being responsive, warm, consistent, encouraging self-esteem, supporting a mutually respectful parent-child relationship. So parenting style, self-esteem, psychological inflexibility, and mental health are significantly correlated. So what is psychological inflexibility? This is when we're stuck or fused in our own thoughts, attitudes, or beliefs. So we become kind of rigid and unable to adapt to the current novel situation that we're in. Inflexible people aren't centered or grounded. They're more worried about their past or worried about their future. They are not able to think outside. They're not able to think about a situation from a different perspective. and they aren't able to accept a range of emotions. So they usually tend to avoid the more difficult emotions. So research shows that negative parenting styles, such as parental overprotection or parental neglect, is correlated highly with children who have low self-esteem and high psychological inflexibility. So those are the rigid kids, right? And it's also correlated with increase in mental health problems. On the other hand, positive parenting, such as parental emotional warmth, this is correlated with children who have high self-esteem and low psychological inflexibility and a decrease in mental health problems. So how does positive parenting encourage self-growth and development? Researchers have reported a significant link between parental warmth and the ability to have emotion regulation. So this ability for effortful control, which is being able to control your emotions, right, was found to predict lower externalizing problems. So what are externalizing problems? Externalizing problems are rule-breaking behaviors, aggression, and impulse control problems. So generally speaking, there are many aspects of positive parenting that nurture children's self-esteem, creativity, belief in the future, ability to get along with others, and a sense of mastery over their environment. This is the fun part now. Let's talk about some positive parenting strategies for teens. So there's a profound change in the parent-child relationship when our children are becoming teens, right? Not only are they not around as much anymore, but when they are around, they're usually in their rooms, they're texting, they're Snapchatting, they're Instagramming, they're doing all the ings. Hopefully they're doing homeworking and Quraning as well, right? Often they might not even want to be seen with their parents, and this kind of peaks at around 14, 15 years old. And these natural tendencies make it very difficult for us to have interactions with our teens. So what does this mean for us? This means that we need to make time for these interactions, and because we have such limited time, we need to make these interactions positive and pleasurable for them so they want to come back for more. Having good self-esteem means feeling valuable and worth loving. So how do we accomplish this in our teens when, during this time, a lot of teen self-worth comes from their peer relationships? Well, that is true, but that doesn't mean that what we say doesn't matter. It is important that we regularly, genuinely praise our children and help foster this self-esteem instead of criticizing them all the time, right? Even though it seems like they're not listening, they are, and they actually really do care. So when they're up here talking to 100, so people, you want them to hear these positive self-talk in their head, not the negative criticism that they might hear from you. Communicating effectively. Most teens still want to communicate with their parents, just not all the time, right? So just because they don't tell you everything about their life and everything that's going on doesn't mean that they're trying to hide something from you. It's just a sign of independence and them wanting to separate from you a little bit. Parents need to make use of the opportunities that they have to have meaningful conversation with teens and learn how to read between the lines because, again, they're not going to tell us everything. Teens often complain that our parents are not listening to us, right? And this could be true at times because when you have little ones and you have a teen, you kind of just push the teen to the side, let them take care of themselves, and you're more focused on the little ones. But make sure that your focus is on them when they come to talk to you. And how can we do this? We can do this by eliminating some distractions. Simple, put away your phone when they're there talking to you. Use love language, L-U-V, right? This is listen, understand, and validate. When your teen speaks, use active, reflective listening. Repeat your teen's major points by saying, for example, if I understand you correctly, you seem to be very upset and worried because your teacher seems to be giving you a lot of advanced work without giving you instruction for it. So as you could kind of hear that, I attached an emotion to that statement. And that kind of prevents misunderstanding, and it also helps them identify their own emotion, right? Over the next few weeks, bring it up again. Ask about the level of work that they're receiving. Ask about how they're managing it. Ask about how they feel about it. By doing this, you're telling them that you are listening and that you care. Empathy is listening without judgment and trying to connect on an emotional level. And this is our goal here. We want to try to connect on an emotional level with our kids. They don't always want advice from us. They don't want us to solve their problems, and quite frankly, that's probably not healthy. But they do want us to know that they do want to know that we are understanding them and that we're acknowledging what they're going through, so that we're there to offer support and guidance to them. Teens are often afraid to talk to their parents, right, about sensitive issues or problems because they're afraid of negative reactions from us. To encourage honest disclosure, create an emotionally safe environment by giving these problem passes that I have on here. So giving this problem pass, you're making a commitment to a calm reaction when they drop a bomb on you, right? So for some kids, you're gonna have to give them a few more problem passes because they're more accident prone. But basically, you give them these GTs beforehand, right? And you're basically telling them, well, let me read what one might say. So one of these GTs might say, I have a problem that if you knew about, you might get angry or upset. So even though I'm still responsible for my actions, by accepting this pass, you agree to help me problem solve without saying, I told you so, I can't believe you did that, or getting angry. So what does this do when they give us this, right? It helps to open communication. It allows for a safe environment for them to come with you when they have a problem. And right now, these problems might seem small, right? But in the future, if there ever is a big problem, you want them to feel comfortable coming to you. And that's the goal with this. So a lot of parents don't know the difference between punishment and discipline, right? So let me give you a couple of examples, and these are real examples. You haven't done your Quran yet. You aren't going to that movie tomorrow night, and you better go straight to bed after dinner. That's punishment, right? Discipline. You haven't done your Quran, your homework. What's hard about it? Is there something getting in the way? Is it difficult to start? How can I help you? I suggest that you do it now before dinner so it doesn't go into your gaming time after dinner. Punishment. You're throwing the football around in the house again, and now you've broken my vase. That's it. Give me your iPhone, give me your iPad, and you aren't going to Sunday football this weekend. Discipline. You're throwing the football in the house again. I'm upset because that vase was very important to me. Where should you be playing with this football? Okay, come and help me get some glue and let's try to fix it. Do you guys hear the difference between the two? Punishment is literally making somebody feel bad and suffer for making a wrong choice, right? It's not about teaching skills and problem solving. Whereas discipline, it teaches us appropriate behavior, problem solving, and empathy. As parents, we are teachers, and our kids need to learn from their mistakes. Empty threats and reprimanding, they don't work in the long run. Instead, we need to focus on being patient. And how hard is that, right? When we have 1,000 things going on in our lives, we have deadlines to meet, we have other kids, we have work, we have so many other things to do. That is difficult, but this is when it matters. Use your words to explain what you mean. Rule of thumb, don't overreact, be clear about the rules, listen before you act, get input from your teen, sit down with them, talk about what house rules should be, put them on paper, stick them on the wall, hold them accountable for it. Hear them out because they might actually be fair. Also, remember the power of praise. Remember to compliment them for handling life well. Resolving conflict. It may feel like they're arguing with you for the sake of arguing, right? They're arguing until the cows come home, even about the sky being blue. Chronically disagreeing with you may be your teen's way of showing that he or she is a unique individual. Pay attention to the need. What is the underlying reason for why they're arguing? More spontaneous conflict that has no underlying theme may mean that they're seeking your attention. And this is difficult, right? Because on one hand, they're like independence, independence, independence. And on the other hand, they're wanting your attention. So this is where this meme kind of comes into play. Tweens be like, I got it, I know how to do everything, and then you gotta teach them how to use a bar of soap when the body wash runs out, right? A way to handle conflict might be to set up a regular discussion time. Every Sunday night after dinner, you're gonna take a walk. They know that this is their regular time to talk to you. They're gonna come prepared with stuff, whether it's to renegotiate the house rules or whatever it might be. You are giving them opportunity to be heard, and I guarantee you when you do this, they are more likely to listen to you too. So how do we teach values in our kids, right? An important developmental task of adolescents is learning to make sound decisions that are guided by personal values and opinions. And we've been teaching them values since the day they were born, right? What's right, what's wrong, hopefully they're incorporating everything into their daily life. But really, these years, they're really trying to formulate their own opinions and value system. As a parent, you're the #1 role model, so we need to be more aware of the messages that we're sending across. Are you always honest? Do you ever ask your child to lie for you? Do you avoid gossip? Do you show respect for other people? Do you practice good health habits? Do you treat your own life as valuable? How do you engage in self-care? The CDC 5-year trend report shows that in the past 5 years, parents are reporting a decline in caregiver well-being. Parents are reporting heightened stress. Why? Well, because parenting is stressful and it's very hard, and there's a lot at stake, right? We want to be perfect. We have so many things we want to teach our kids. There's not enough time in the world to make them perfect, and it's not even possible. It's like the oxygen mask analogy, right? You got to put on your mask first before you put it on your child. You have to make sure that you're healthy, physically, mentally, emotionally, spiritually. This will make us better parents. So how can we be more emotionally available and present parents? We can try to practice self-care every day, and self-care is to proactively care for yourself. It teaches you how to deal with life stress that continues, and it will continue. It's a lifestyle, and it has a major impact on our happiness and our satisfaction with life. For me, some examples might be making sure, little things, making sure that मैं 5 नमाज अदा करूँ छू, दुआओं करूँ छू, तस्बीहो करूँ छू, मोलानी हजरत मा जाऊँ छू, नजरों मा काम सदका, ये सगलू self-care मा गिनाई छे. And then, as a parent and in the healthcare field, one thing that I've really focused on is my practice of mindfulness. Mindfulness exercises help to ground you. They help you be more present and aware of where you are and what you are doing. I use this myself both at work and on my way home from work, because we all know that sometimes it's like going from work trauma to home trauma, right? Mindfulness decreases stress and improves your relationships. It clears your mind and prepares you for being present in the next situation you're in, whether that's another patient or that's your children. As the last part of this presentation, I would like to invite you all to practice a gratitude mindfulness technique with me. Gratitude is a spiritual practice, and it helps you notice and appreciate all the little namato that you have in your day-to-day life. It helps you see and appreciate all the good around you when modern life forces you to focus on the bad, what needs to be fixed immediately, what crisis needs to be prevented, and the new thing that you need to get to make your life better. Learning to focus on the good takes time and practice, but every time you flex that gratitude muscle, you get stronger. So I want to invite you guys to practice this with me. Okay. Take some time to place yourself in a comfortable position. Take a few deep breaths in through your nose and out through your mouth. And let your chest rise and fall with each inhalation and exhalation. When you are ready, let your eyes close. As you continue to breathe slowly and deeply, let your attention rest gently on your breath. Breathing in relaxation and breathing out tension. Feeling the movement as it enters and exits your body. Relax your face, your shoulders, your belly, your legs. On your next exhale, settle your attention to the area around your heart. Focus on the feelings of love, compassion, empathy, forgiveness. With your attention on your heart center, bring to mind something or someone you are grateful for. Alhamdulillah, shukran lillah. Now we are going to practice a gratitude tasbih. The tasbih is, Alhamdulillah, shukran lillah. I am grateful for blank. Please fill in the blank with something or someone you are grateful for. We will repeat it 3 times, and I ask that you think about something or someone different each time. Let's begin. Alhamdulillah, shukran lillah. I am grateful for. Alhamdulillah, shukran lillah. I am grateful for. Alhamdulillah, shukran lillah. I am grateful for. Now bring your attention to how this gratitude feels in the area around your heart. With each inhale, let this feeling grow outwards, expanding to fill your chest, your arms and hands, your legs and feet. With each inhale, this feeling grows, filling you up. And now, even as you return your attention to your breath, let your body remember the sensations of your gratitude. You may open your eyes when you're ready. How was that for everyone? We all need more of that in our lives, right? So take-home message. There is a growing concern for mental health issues in pediatrics, which are shown to have a lasting impact into adulthood. Parental childhood involvement is a protective factor for mental health problems. Positive parenting fosters an empathic parent-child relationship and effective communication, which leads to a better mental health outcome. Positive parenting is correlated with a high self-esteem and low psychological inflexibility, which leads to a better mental health outcome. आखिर में मैं दुआ करूँ छूँ कि खुदा ताला हमारा बच्चाओं ने हिफाजत में रखे, मेंटल हेल्थ नी बीमारी से दूर रखे, अने हमें बच्चाओं नी तरबियत मौलानी खुशी मुताबिक करी सके. अपने तो फ़कत 1 या 2 या 3 फर्जंदों नी तरबियत करवानी छे. सैयदा मुफद्दल सैफुद्दीन आका जे हज़ारों मोमिनीन नी तरबियत करी रहा छे, ये मौलानी उमर शरीफ ने क़यामत ना दिन लग दराज न दराज करजो. शुक्रान.
Okay, I'm the last thing between you and lunch, so I hope to get you there very quickly. So Dr. Bharmal was able to lay the foundation for you about what the crisis is, and I have the good fortune to talk about what some of us believe might be the solution. And so I'm here representing my team, the team that Mufaddal Bhai spoke about before, to talk to you about how we thought through a possible curriculum, and we are excited to present this data and also to hear your feedback. So the first thing that happened is that we needed to think about why we needed a curriculum to begin with. And so that's the spark, and that happened at this meeting a year ago. We were not in Dallas, we were in Chicago, but a group of us were sitting in Dr. Lulua Mandviwala's talk, and she was talking about all of the exposures that our children and our adolescents are exposed to. And it became really obvious to us that this is not a problem that's just American adolescents. These are exposures that are happening to our adolescents in our community. And how are we as medical professionals not doing anything about it? And so it was in that room that a group of us, in that moment, decided we are going to come together and do something. And that was the spark for the beginning of talking about a curriculum. And I wanted to reflect on this journey that I've been with this team for the past year. And I thought about when we first started thinking about a curriculum, we needed inspiration. And where does our inspiration always come from? It comes from Mola. And so I thought about my experience during Dubai Ashara this past year. And during Ashara, Mola expounded on a proverb, and he said, give a man a fish, feed him for a day. Teach a man to fish, feed him for a lifetime. And this is how we approached this curriculum. As medical professionals, as pediatricians, as child psychologists, as educational experts, people in our jamaats come to us all the time with a problem going on with their kid. We help them to the best of our ability. It's one kid, one problem. We help them. We essentially give them a fish. We fed them for a day. We solve their problem. But what we realize is, let's teach them the skills to solve all of the problems that are going to come up. And so that's why we thought about creating a curriculum. We want to teach our fellow mu'mineen to fish so that it can feed them for a lifetime and ideally feed generations of mu'mineen for a lifetime. So it is with Mola's inspiration, Mola's dua, with Amir Bhai Sab's guidance, with Sayyidi Muqarsis Sab's guidance and raza that we took on this curriculum. Oh, here we go. So the first thing that we did is we decided that we need to know what the parents and kids that we are aiming this parenting curriculum at, what do they want us to teach them? And that in medicine, and those of you who do educational research, is called a needs assessment. What are the needs of this population that we're serving? And so we developed 3 different surveys that were spread in 3 jamaats, in Chicago, in Houston, and in Orange County. And those surveys were for parents of preteens and teens. It was for 10 to 12-year-old children and for 13 to 16-year-old children. And note that for the kids, the surveys were different based on their age, and they were done with the consent of their parents. However, the parents did not see the kids' surveys, the kids did not see the parent surveys, and everything was anonymous. And so we have no way of sort of tracing back which kid answered what. And so because of that, we got some really excellent responses. They were both multiple choice as well as lots of sort of tell us what you're thinking, and people really did tell us what they were thinking. And so we are here to tell you a little bit about what we learned. And in these surveys, we explored all of these topics. So we asked questions about nutrition and exercise and body image. We asked questions about education and career exploration. We talked about social media, about gaming and video games, and then more serious topics like drug use, cigarette use, alcohol use. We talked about mental and social health, navigating peer pressure, romantic relationships, sexual health, sexual identity, gender. Nothing was left sort of unturned. We wanted to know about all of it, and what's important is we wanted to understand where kids felt like they were getting this information, where parents thought they were getting the information from. But we also wanted to understand how are parents and kids communicating with each other right now, and how do they think that they should communicate with each other in the future. And then here I wanted to share a little bit of the demographic data. So these are the kids surveys that we did. We were hoping for 30 responses each. We got some nice responses, 46 for the 10 to 12-year-olds and 13 to 16, for the 13 to 16-year-olds, 53 responses. And you can see here sort of how it was laid out, what ages they were. They represented different ages in school, elementary, middle school, and high school, depending on their age. The parent demographics, we were hoping for 100. We got 150 responses, we're really thankful for that. The vast majority of responses came from our bigger jamaats, right? Chicago and Houston. The majority of people who were answering the survey were the mothers, right? So you can see that it was the moms that were answering. There's a predominance of female responders, but some of the dads did as well. We had about 35% male responders. And for the parents, what we really wanted to understand as we're putting together a parenting curriculum is how many of these parents actually had the exposure that their kids are getting. How many of them were raised in America, went through the American educational system? And so what we learned is 70% did not live in America prior to their misak at all. 48% did not do any grade school, so kindergarten through 12th grade, and then 38% did not do any education, and that includes college, master's, doctorates, etc. So this is important information for us to know as we're creating this, because we want to know what background are the parents coming from to begin with. And so these are some of the takeaways that we came away with. The most important one is the one that's listed there. The vast majority of children told us that the information about all those topics that I spoke about, they wanted to come from their parents. They are not getting it from what we think. Social media, internet, friends, they want the information from their parents. And so it behooves us to provide parents the information necessary so they can do that with their children. Parents also want help. 76% of parents said, I need to know how to communicate with my child. Please help me to do that. And so they're asking for our help, and we are happy to do that. Children want their parents to listen to them. This is something that Dr. Bharmal was talking about. We're in our phones, we're not paying attention. Children are overwhelmingly saying, my parents aren't listening to me. How can we help that? How can we teach that? I'm going to go through some of these just for sake of time. I want to also just really point out the very important thing at the top there about mental health. We just heard about how important the mental health crisis is. This is really important. Children are begging for their parents to talk to them about mental health, and parents don't feel comfortable doing that. So how can we equip our fellow mu'mineen to feel more comfortable doing that? So given all of these takeaways, our group came together with the following mission statement. And the most important parts of the mission statement are in the colors there. So we not only want parents to learn the techniques that we're teaching them, but during the curriculum, we want them to practice them. And when you practice something, then you'll actually be able to use it in your daily life. And so with that, we are going to be teaching communication techniques and relationship building skills. And this is all going to be evidence-based and taught by experts within our community. And so this very last part, I promise it's 5 more slides, is where I'm going to tell you about putting all of this data together, the 5 curricular modules that we have come up with. The first module's goal, if we can get there, is that parents will recognize their strengths and challenges as a parent and learn best practice parenting techniques. So this module will really focus on who are you as a parent? How were you raised? Did you like how you were raised? Do you want to use some of those techniques, or are there things that you want to change? And this will really focus on a lot of the things that Dr. Bharmal was talking about in terms of those parenting techniques. The second module will really delve in deep to mental health. We want parents to understand what are the mental health disorders that are out there? What are the signs and symptoms? What should you look out for in your kid? What are the resources available to you to help you tackle these issues? The third module is for parents to explore the social, emotional environments of their children and how best to support them in these environments. So while the first module focuses on who are you as a parent, this module focuses on who is your child? Who are they? Who are they in your family? Who are they in your jamaat? Who are they in madrasa? Who are they in school? Who are they as a budding career professional? Who are they, and how do you best speak to them? And also understand the things that are difficult for them. One of the major points that came out in the kids surveys is that a lot of our kids, they may not be telling us, they're experiencing bullying and racism in school and in madrasa. So how can we understand this better? How can we help them? How can they feel comfortable communicating with us about that? The fourth module is for parents to understand the American educational system. And this really came out from the fact that we learned that many parents have not sort of experienced the American educational system. So we have high expectations for our kids, but maybe we don't understand kindergarten readiness. Maybe we don't understand ADHD. Maybe we don't understand that even kids that are gifted and talented can have challenges, especially social emotional challenges. And so this module will really explore that. And then the last module is for parents to understand physical and relational health topics relevant to their children. So this is where we're really going to get into drugs, alcohol, substance use, romantic relationships, puberty, sexual health, gender issues, all of these things. And also really focus on body image, body shaming, things that are happening sometimes in our own homes and in our own communities that we need to be aware of. So this is your invitation after lunch to please join myself and a bunch of other people in our group to practice the curriculum. We're going to teach you a part of the curriculum, and as we promised, it will be interactive. You will not be sitting, I promise. And we would love to hear your feedback on it. Shukran.